Welcome to Med 3, Health. Today, we're diving into why sleep apnea makes you feel so tired during the day. Even after a full night's sleep, sleep apnea can cause you to stop breathing briefly, waking you up multiple times. This leads to tiredness, difficulty focusing, and mood swings. Morning headaches and a dry mouth are also common. If untreated, sleep apnea can even affect your daily activities and work performance. We'll explore how nighttime symptoms reveal sleep apnea, the diagnosis process, and various treatment options, including lifestyle changes, CPAP therapy, and orofacial myofunctional therapy. This video is for informational purposes only and not a substitute for professional medical advice. Why does sleep apnea make you feel so tired during the day? Sleep apnea can make you feel extremely tired during the day, even after what seems like a full night's sleep. This happens because sleep apnea causes you to stop breathing briefly while you sleep, waking you up multiple times throughout the night. You might find it hard to focus on tasks, and you might even have trouble remembering things. Morning headaches are also common and can last for several hours. Feeling irritable or having mood swings is another symptom, along with a dry mouth when you wake up. Even after a night of sleep, you might still feel tired and sluggish all day long. This tiredness can be dangerous, especially if you feel sleepy while driving. It can also lower your interest in activities you enjoy, including sex. Your reaction times might slow down, and you might notice a drop in your work performance. How do nighttime symptoms reveal sleep apnea? Sleep apnea can be hard to detect on your own, but certain nighttime symptoms can be strong clues. One major sign is loud snoring, often loud enough to wake a sleep partner. Snoring results from pharyngeal narrowing and is common in up to 95% of OSA patients, often getting worse with increased body weight, alcohol, sedatives, or menopause. You might also have pauses in breathing for 10 to 30 seconds at a time, followed by gasping or choking sounds. These observed apneas can cause significant changes in the nervous system and circulatory system. Restless sleep, like tossing and turning, and frequent awakenings are also common. Some people sweat a lot at night or wake up often to urinate. Arousals, which are sudden wake-ups with shortness of breath, can increase heart rate and blood pressure. If you often wake up with a dry mouth or sore throat, that could be another sign, known as xerostomia. Sometimes bad dreams or insomnia can hint at sleep apnea too. Other symptoms include teeth grinding, sleep talking, and excessive salivation issues. If you think you might have sleep apnea, it's important to talk to a doctor for a proper diagnosis. How is obstructive sleep apnea diagnosed? Obstructive sleep apnea, or OSA, is diagnosed with a few key steps. First, doctors look at your medical history and do a physical exam, focusing on your upper airway, neck size, and body mass index. Then, you might need a sleep study called polysomnography. This test, done overnight in a sleep center, measures brain activity, eye movements, heart rate, breathing patterns, blood oxygen levels, and leg movements. Sometimes, a simpler home sleep apnea test is used for those likely to have moderate to severe OSA without other health issues. If the results of the home-based sleep apnea test are negative, it's still possible that you might need to undergo a lab-based sleep study. The reason is that home-based tests may not be sensitive enough and could potentially have missed the diagnosis. Diagnosis depends on symptoms like daytime sleepiness and breathing interruptions during sleep, with tests showing 5 or more obstructive events per hour. Or 15 or more events per hour can diagnose OSA, even without symptoms. The severity is classified by the number of events per hour: mild for 5 to 14, moderate for 15 to 30, and severe for over 30. While home tests are common, in-lab polysomnography remains the most comprehensive method for diagnosing OSA and other sleep disorders. When are imaging scans used for sleep apnea? Sleep apnea is usually diagnosed with a sleep study called polysomnography, done in a sleep center or at home, but sometimes doctors use imaging scans like CT or MRI to check the upper airway anatomy. This helps them see if something is blocking your airways. Imaging is also useful for planning surgery if needed and to rule out other conditions. Cone beam computed tomography, or CBCT, provides detailed three-dimensional images of your head and neck, helping doctors understand the severity of airway constriction in sleep apnea patients. MRI offers detailed images of soft tissues around the airways, useful for treatment planning, like assessing changes after using a mandibular advancement device. Home sleep tests are convenient, but might miss some details, so more tests, including imaging, might be needed. Specialists might use imaging to get a better look at your condition. Remember, imaging is not the first step but can be helpful in certain cases. Advanced techniques like ultra-fast MRI are promising but are not standard yet. How can lifestyle changes help manage obstructive sleep apnea? Losing weight can greatly reduce sleep apnea symptoms, especially for obese people. Even a 10% weight loss can lower the risk of OSA sixfold. Regular exercise, like 150 minutes of aerobic activity a week and 2 days of weight training, can improve oxygen levels, reduce daytime sleepiness, and enhance sleep quality. Keeping a consistent sleep schedule and elevating your head while sleeping can improve your sleep quality. Eating healthy foods like fruits, veggies, lean proteins, and whole grains, and avoiding heavy meals before bed is crucial. Limiting alcohol and quitting smoking can prevent throat muscles from relaxing too much and causing inflammation. Creating a cool, dark, and quiet sleep environment, avoiding sedatives and sleeping on your side can help keep your airway open. Treating allergies and practicing mouth, tongue, and facial muscle exercises can further reduce symptoms. Lastly, using a humidifier can help protect against CPAP failure for those using CPAP therapy. How does orofacial myofunctional therapy help with sleep apnea? Orofacial myofunctional therapy, or OMT, uses exercises to strengthen the muscles in your mouth and face. These exercises aim to improve muscle tone, endurance, and coordination to keep your airway open while you sleep, reducing airway collapsibility. OMT includes isotonic and isometric exercises, like sliding your tongue along the roof of your mouth and puffing your cheeks with air. Tongue exercises. Slide your tongue along the roof of your mouth from the front teeth to the back. Press your tongue against the roof of your mouth and hold for a few seconds. Palate exercises. Lift your soft palate by making a K sound repeatedly. Stretch your soft palate by yawning or simulating a yawn. Lip exercises. Press your lips tightly together and hold for a few seconds. Stretch your lips by smiling broadly and then relaxing. Cheek exercises. Puff out your cheeks and move the air from one cheek to the other. Press your cheeks with your fingers while trying to puff them out. Breathing exercises. Focus on deep diaphragmatic breaths to strengthen the breathing muscles. Practice breathing in and out through your nose to encourage proper airway function. Studies show OMT can reduce snoring, improve oxygen levels, lower the apnea-hypopnea index by 50% in adults and 62% in children, and decrease daytime sleepiness. An intensive 8-week program followed by regular exercises over 6 to 12 months is typical. OMT can be used with other treatments like CPAP therapy and can improve CPAP adherence. It's a non-invasive and painless way to treat sleep apnea, also helping with issues like improper tongue posture, swallowing abnormalities, and speech difficulties. Remember to talk to your doctor to see if OMT is right for you. How can you treat obstructive sleep apnea? Well, there are several ways to treat obstructive sleep apnea. The most common and effective method for moderate to severe OSA is using a CPAP machine, which helps keep your airway open while you sleep. Lifestyle changes like losing weight, reducing alcohol, changing sleep positions, and managing nasal congestion can also help. For mild to moderate OSA, wearing special dental devices called oral appliances during sleep can push your lower jaw forward, opening up your throat. Surgery is an option if other treatments fail. This can include removing tissue, repositioning the jaw, implanting a hypoglossal nerve stimulator, or in severe cases, performing a tracheostomy. Other options include auto CPAP, which adjusts pressure automatically, and BPAP, which provides different pressures for inhaling and exhaling. Positional therapy helps prevent sleeping on your back, and treating underlying conditions like thyroid problems or enlarged tonsils can also reduce OSA. CPAP is the gold standard, but sometimes a combination of treatments is needed. It's important to work with your doctor to find the best treatment plan for you. How effective is CPAP therapy for sleep apnea? CPAP, or continuous positive airway pressure therapy, is the gold standard for treating moderate to severe obstructive sleep apnea. When used properly, CPAP can be 100% effective in correcting sleep apnea by keeping the airways open during sleep, preventing breathing interruptions, and maintaining proper oxygen levels. CPAP therapy significantly improves sleep quality and reduces symptoms like daytime sleepiness, morning headaches, and irritability. It also lowers the risk of serious health issues such as heart disease, stroke, and diabetes. CPAP improves quality of life for patients, even in mild cases. However, Its effectiveness depends on consistent and proper use, and finding the right mask fit and pressure settings may require adjustments. Some patients find CPAP uncomfortable or cumbersome, which can lead to poor adherence. For those who cannot tolerate CPAP, alternative treatments like oral appliances, positional therapy, and surgery are available. Working closely with healthcare providers is crucial to ensure proper fit, settings, and adherence for the best results. For mild sleep apnea, treatment decisions should be based on individual symptoms and preferences. Can nasal steroids help treat sleep apnea? Nasal steroids might help treat sleep apnea, especially for people with nasal congestion or rhinitis. Research shows that intranasal corticosteroids like fluticasone can reduce the apnea-hypopnea index in patients with obstructive sleep apnea and rhinitis. This means fewer breathing interruptions during sleep. Nasal steroids work by reducing nasal airflow resistance, making it easier to breathe. In kids with sleep apnea, fluticasone spray improved symptoms, cutting the apnea-hypopnea index from 11 to 6 per hour. However, nasal steroids are not a cure-all and work best for mild to moderate cases with nasal issues. It's important to note that there are currently no approved drug treatments specifically for obstructive sleep apnea in adults. Continuous positive airway pressure, CPAP machines, remain the primary treatment for many patients, though tolerance can be an issue. Research is ongoing into new potential treatments for sleep apnea, including nasal sprays that target specific receptors in the upper airways. These emerging therapies aim to prevent the narrowing or collapse of the upper airways during sleep. What are the alternatives to CPAP for obstructive sleep apnea? If CPAP isn't working for your sleep apnea, there are other options. Oral appliances like mandibular advancement devices can keep your airway open, especially for mild to moderate cases. Alternative PAP therapies include BiPAP, which provides different pressure levels for inhalation and exhalation, and APAP, which automatically adjusts pressure based on breathing patterns. Lifestyle changes like losing weight, exercising, avoiding alcohol and smoking, and sleeping on your side can also help. For severe cases, surgeries like maxillomandibular advancement, uvulopalato-pharyngoplasty, and Inspire therapy are available. Positional therapy uses devices or techniques to prevent sleeping on your back. Nasal valve therapy, such as devices like Provent, creates pressure in the airway using your own breathing. The Buteyko breathing method focuses on retraining breathing patterns. Always talk to a sleep specialist to find the best treatment for you. How does losing weight help with sleep apnea? Losing weight, especially around 5 to 10% of your body weight, can really help with sleep apnea. It can reduce symptoms by up to 50% in some people. When you lose weight, the fatty deposits in your neck and tongue decrease, making it easier to breathe while sleeping. This also improves lung function and makes your airway less likely to collapse. Studies show that losing weight reduces tongue fat, which is a big factor in sleep apnea. In some cases, significant weight loss can even resolve mild sleep apnea. Additionally, weight loss improves overall health and reduces risks for issues like high blood pressure, insulin resistance, and type 2 diabetes. It also makes other treatments, like CPAP, work better. Remember, it's important to lose weight under medical supervision and continue with prescribed treatments until a doctor confirms improvement through sleep testing. Maintaining a healthy weight through proper diet and regular exercise is key for long-term management of sleep apnea. How can untreated obstructive sleep apnea affect your health? Untreated obstructive sleep apnea can cause serious health problems. It increases the risk of high blood pressure, heart disease, heart failure, irregular heartbeats, and stroke. You might also develop insulin resistance and type 2 diabetes. Metabolic syndrome, which includes high blood pressure, abnormal cholesterol, high blood sugar, and a big waistline, can be another outcome. Liver issues like non-alcoholic fatty liver disease are also possible. You'll likely feel tired during the day, have trouble focusing, and be at higher risk for accidents. Mood changes, depression, and even personality changes can happen too. If you need surgery, untreated OSA can lead to breathing problems, including cardiac arrest and respiratory failure. It can also reduce your libido, and for men, cause impotence. Severe OSA might increase your risk of cancer and death. OSA can worsen asthma and acid reflux as well. Treating OSA, especially with continuous positive airway pressure, CPAP therapy, can help manage these risks. How can I improve my sleep apnea symptoms with better sleep hygiene? To improve your sleep hygiene and reduce sleep apnea symptoms, try these tips. First, sleep on your side, or if on your back, elevate your head. Keep a consistent sleep schedule, even on weekends, to help regulate your internal clock. Make your bedroom a relaxing environment, cool, dark, and quiet, with comfortable mattresses and pillows. And consider using blackout curtains or an eye mask to block out light. Establish a bedtime routine with activities like reading or meditation. Avoid stimulants like caffeine, nicotine, and alcohol, especially in the evening. Eat a healthy diet rich in fruits, vegetables, lean proteins, and whole grains, and avoid heavy, high-fat, or spicy meals close to bedtime. Exercise regularly with at least 30 minutes of moderate aerobic activity each day. Maintain a healthy weight, as it can significantly improve or even resolve sleep apnea symptoms. Quit smoking to improve breathing and sleep quality. Finally, consider using a CPAP machine or dental appliance if prescribed by your doctor. Remember, improving sleep hygiene is important, but it may not be enough on its own. Work with your healthcare provider to develop a comprehensive treatment plan. Can medications help treat obstructive sleep apnea? While there's no FDA-approved medication to fully treat obstructive sleep apnea, or OSA, some drugs can help manage its symptoms. There's no single pill that can cure OSA, and CPAP therapy remains the most effective treatment. However, stimulants like modafinil can reduce daytime sleepiness. Weight loss drugs can aid overweight patients by promoting weight reduction. Nasal decongestants might improve mild OSA by keeping nasal passages open. Promising research includes acetazolamide, which helps by causing deeper breathing, and combinations like atomoxetine with oxybutynin that reduce the apnea-hypopnea index. Reboxetine, an antidepressant, has shown to reduce OSA severity. Certain medications like barbiturates, benzodiazepines, and those causing weight gain can worsen OSA. Treatment should be tailored to individual needs and OSA phenotype. More research is needed to confirm the long-term safety and effectiveness of these treatments. Can a Mediterranean-style diet reduce sleep apnea symptoms? Yes. Following a Mediterranean-style diet can help manage obstructive sleep apnea, or OSA. This diet is rich in whole grains, fruits, vegetables, nuts, and legumes. These foods are high in anti-inflammatory components and antioxidants, which can help manage body weight and reduce inflammation, both crucial for lowering OSA risk. Incorporating more healthy plant-based foods like fruits, vegetables, whole grains, nuts, and legumes can lower the risk of OSA. Avoid unhealthy plant-based foods such as refined grains, sugary foods, and unhealthy fats. Reduce processed and ultra-processed foods, including processed meats and salty snacks, as they can exacerbate OSA symptoms. Maintaining a balanced diet can significantly reduce OSA symptoms, with one study showing a 51% reduction in sleep apnea episodes per hour of sleep. Obesity contributes to airway narrowing, and even a 10% weight gain can increase sleep apnea risk sixfold. Losing weight through a reduced calorie diet and regular exercise can help manage OSA symptoms. Limiting alcohol consumption can further help by preventing throat muscle relaxation during sleep. Regular exercise and maintaining a healthy weight are essential lifestyle modifications for improving OSA symptoms and overall health. How do alcohol and smoking worsen sleep apnea? Well, alcohol and smoking can make sleep apnea worse in many ways. Drinking alcohol relaxes muscles in your mouth and throat, causing blockages in your airway during sleep. It also makes it harder to wake up when you stop breathing, leading to longer apnea episodes. Alcohol increases the number and length of breathing pauses, known as the apnea-hypopnea index, or AHI, and lowers oxygen levels. It can even cause nasal congestion, making breathing through your nose harder. Smoking also raises the risk of sleep apnea. Smokers are more likely to have moderate or severe sleep apnea compared to non-smokers. Smoking can change sleep patterns, affect airway muscles, and cause inflammation in the upper airway, all of which worsen sleep apnea. It also affects the neuromuscular function of the upper airway. Together, alcohol and smoking not only worsen sleep apnea, but also increase the risk of heart problems and drowsy driving. To manage sleep apnea, try limiting alcohol, especially before bed, and quit smoking. How does sleeping position affect sleep apnea? Did you know your sleeping position can make a big difference if you have sleep apnea? Sleeping on your back is the worst because it makes your throat close up more, doubling your breathing problems. But if you sleep on your side, it keeps your throat open and helps you breathe better, often decreasing the number and severity of breathing episodes. For some with mild sleep apnea, side sleeping alone might be enough to help. Sleeping upright or with your head elevated can also help, especially if you have other issues like heartburn or heart problems, leading to fewer breathing disruptions and better oxygen levels. While sleeping on your stomach might help some people, it can hurt your neck and isn't usually recommended. Your sleeping position's impact can vary. Some have much worse symptoms on their back, while others don't notice much difference. Changing your sleep position can help, but it's not a complete fix. Many people still need treatments like CPAP therapy. How often should you follow up with your doctor for sleep apnea? For sleep apnea patients who are stable and following their treatment plan, it's best to have an annual checkup with your doctor. This helps review your progress and make any needed changes. If you're new to treatment or having problems, visit your doctor every 3 to 6 months. Experiencing issues like weight gain or other complications? Go for follow-ups twice a year. If you stop feeling better even with regular therapy use, contact your doctor right away. Significant weight changes or other health issues might need more frequent visits. Doctors may use home sleep tests or portable monitors to track progress, but these shouldn't replace regular checkups. Remember, consistent follow-ups keep your treatment on track. What are the surgical options for treating obstructive sleep apnea? There are several surgeries to treat obstructive sleep apnea in adults. The most common is uvulopalatopharyngoplasty, or UPPP, which removes parts of the tonsils, uvula, and soft palate to widen the airway. Maxillomandibular advancement moves the upper and lower jaws forward for a bigger airway. Genioglossus muscle advancement shifts the chin bone to stop the tongue from blocking the airway. Tonsillectomy is good for adults with mild to moderate OSA and big tonsils. Hypoglossal nerve stimulation uses a device to control the tongue and keep the airway open. Other options include nasal surgeries like septoplasty and turbinate reduction to improve breathing and CPAP tolerance, tongue-based surgeries to reduce obstruction, and soft palate procedures like lateral pharyngoplasty and palatal advancement. Maxillomandibular expansion widens the jaws to create more room for the tongue. Tracheostomy, a last resort option, creates an opening in the windpipe to bypass the obstruction. The choice of surgery depends on the patient's anatomy, severity of OSA, and other factors. These surgeries are considered when CPAP therapy is not tolerated or ineffective. Success rates vary and ongoing follow-up is often needed. If you found this video helpful, please give it a thumbs up and subscribe to Med3 Health for more medical insights and tips. Don't forget to hit the bell icon so you never miss an update. If you have any questions or want to share your experiences with sleep apnea, leave a comment below. Remember, if you're experiencing any symptoms of sleep apnea, consult with your doctor for proper diagnosis and treatment. Thanks for watching, and take care of your health.